If 2020 was all about how COVID-19 spread across the globe, then 2021 has so far been all about trying to end the pandemic primarily. But do things ever go as planned? No, right? This journey has been full of ups and downs, highs and lows, और ये सफर बिल्कुल भी आसान नहीं रहा है। और इस सफर में शील्ड की तरह हमारी सुरक्षा करी है सिर्फ एक चीज ने, और वो है ये मास्क। This is something of utmost importance. मैंने तो अभी ये मास्क उतारा है आप तक ये खबर पहुंचाने के लिए, लेकिन आप गलती से भी ये मास्क ना उतारें। तो चलिए अब आपको मैं लेके चलती हूँ towards all the developments with regards to COVID-19 that we saw so far in the year 2021. तो चलिए सबसे पहले लौट चलते हैं इस साल के शुरुआती दौर यानी जनवरी में।
India conducted the first nationwide dry run for all the states and union territories. DCGI approved the Bharat Biotech's vaccine candidate Covaxin for restricted usage in emergency situation in India. India then conducted second nationwide dry run in all states and union territories. The government placed a purchase order with Serum Institute of India for over 11 million doses of Oxford COVID-19 vaccine Covishield. The first consignment of Covishield had left for Delhi 4 days ahead of the nationwide inoculation drive launch. By January 26th, India reported a record low case count of around 9,100 new cases. February. The second dose of vaccination started for those who had completed 28 days since receiving their first dose of the shot. In good news, India had then completed 1 crore vaccinations in 34 days, becoming the second fastest in the world after United States. And during the first half of February, the average daily new case count for India fell below 9,000 cases. But the fall didn't stick for long. By mid-February, the Union Health Ministry revealed that 2 new strains of COVID-19 has been detected in India. The centre said that 187 people had tested positive for the UK strain and 6 people had detected the South African strain, and there was 1 Brazilian strain in India. And after a brief lull, the variant strains pushed up the overall tally. And then it felt like the beginning of a dawn, as by 22nd February, India had surpassed 11 million total cases with more than 150,000 deaths. March. And to fight back with full swing, India began with the second phase of vaccination drive in the month of March. All people above the age of 60 and those between 45 and 59 with specific comorbidities were eligible initially. The vaccination drive was given the utmost priority as India crossed the milestone of 3.15 crore vaccinations by mid of March. But having said that, at the same time, Maharashtra reported around 30,535 cases in a single day, and India overall reported 46,951 cases in a single day, the highest spike since November. And by 29 March, India had surpassed 12 million total cases as the daily case count reached 68,020, breaking all the records. April. Then by 2nd April, India reported around 89,129 cases and the most in more than 6 months. More than 7 million vaccines had been administered. Government made sure that vaccinations were made available to all the Indians over the age of 45. By 5th April 2021, everything had begun to close due to the rise in the COVID-19 second wave. Only online deliveries were free at this stage. Several states and union territories imposed complete lockdown, whereas some imposed partial lockdown and major restrictions only. By 9th April, India had again surpassed the 13 million total cases as the country recorded another record high of daily case count, around 131,968 cases and 780 new deaths. Many states including Maharashtra, Orissa and Punjab reported vaccine shortage, and many districts in Maharashtra were forced to suspend vaccination drives. By 10th April, for the fifth time in a week, India recorded a new record number of daily cases with 1,45,384 new cases. On 12th April, the DCGI had approved the Russia Sputnik V vaccine for emergency use in India. A phase 3 trial was conducted in the country in September 2020, which showed a 91.6% efficiency. By 14th April, India recorded more than 2 lakh new daily cases for the first time, more than double the peak of the first wave. Many hospitals around the country reported shortages of beds and supplemental oxygen and other required medical equipments.
I still remember the scare, the fear this shortage of medical equipments had put the nation into.
By 15th April, India surpassed 14 million total confirmed COVID-19 infections nationwide, as the country reported a record of 2,73,810 new daily cases. Hotels and banquet halls were converted into makeshift hospitals as the regular hospitals in the region had reached capacity. By 17th April, India reported 2,61,500 new cases and recorded over 1,500 new deaths from the disease.
Crematoriums were running non-stop. Some had even begun to melt their metal parts, leading to speculation by experts the actual death toll had been undercounted.
India had recorded more than 1.6 million cases in the span of just a week. For the fourth day in the row, India had set a new record for most cases in the single day by any country, with nearly 350,000 new infections. May. On 1st May, India officially had expanded the eligibility of vaccines to all the adults over the age of 18. On 4th May, India surpassed the 20 million total cases count since the start of the pandemic. With this record-breaking increase, India's demand for supplemental oxygen had increased 7 times over in the last month. By May 12, it was reported that many COVID-positive patients were being infected with a potentially fatal black fungus, with at least 300 cases in the state of Gujarat, which became a major concern for the experts during that time. But gradually we saw that the number of cases had begun to steadily drop by late May. The country reported 1,95,994 new cases, its lowest daily increase since 13th April. The mortality rate, though still remained high, India recorded over 3 lakh deaths attributed to COVID-19. In May 2021, WHO had also declared the 2 new variants first found in India, referred to as Delta and Kappa. June. Then in the month of June, we saw a rapid decline in the number of active cases, and the recoveries, on the other hand, started to increase parallelly. The daily death count fell as alongside the case count. From 15 June 2021, many states had begun lifting lockdowns and restrictions and moved to the unlock phase. And then from July till October, India witnessed a decline in the overall death toll and even in the active COVID-19 cases.
The statistics were quite constant and the world gradually opened back.
People started going back to offices, colleges and schools. The markets were open once again, and gradually so were the gyms and the cinemas. Life indeed gradually moved back to normalcy. By 17th August, India had administered over 550 million vaccinations, and by 21st October, India crossed the 1 billion mark of vaccinations. November. While normalcy was kicking in gradually, the month of November was hit by a dangerous variant of COVID-19, Omicron. By November 25th, the WHO confirmed the first sample of the new Omicron variant in South Africa. The first Omicron case of India was a 66-year-old South African national who travelled to India. On December 2, India detected a case in Karnataka. Post that, the country has logged more than 700 cases of this variant. Before it was reported in India, Omicron cases had already been found in over 29 countries. In the wake of rise in Omicron cases, the daily COVID-19 cases in India is expected to increase again too. Experts are also predicting a third wave in India, but they are also predicting it to be milder than the second wave.
Well, that's a roundup of all the developments with regards to COVID-19 that we saw so far in the year 2021. The Omicron has just entered. But how long is it gonna stay? What will be the consequences? Will there be a third wave? Is the lockdown happening anytime soon? अगर आपके दिमाग में भी ये सभी सवाल हैं तो इसका जवाब हम खुद हैं. We can contain the situation. We can together fight this pandemic out. कितनी देर ओमाइक्रॉन सस्टेन करेगा ये भी हमारे ही हाथ में है. All we need to do is follow all the safety protocols, be it vaccination, sanitization, or avoiding going to huge public gatherings. And the most important, wear your mask. This is your shield. Don't forget that. Also, don't forget to like, share and comment on this video. And don't forget to subscribe to our channel for more such interesting content. Stay healthy, stay safe and wear your mask.